Coming up in today's video, guys, we have a perforated eardrum and some really difficult stubborn wax plugs for you. My name is Rhys, Barber. I'm one of the audiologists here at Audiology Associates.
And my name is Taylor Green, and this is my patient to start with. So we have quite a lot of dry skin. Patient is unable to use any oil just due to the previous history of issues with the eardrum. And you'll see what I mean by that in a second. The eardrum does look very heavily scarred, and there's a little perfo you can see in the corner. I also apologise, guys. I'm losing my voice at the moment. I'm talking too much in clinic. That's my problem.
That's what it is, yeah.
But yeah, we got I think this is the fine end. Tend to find with these little thin pieces of skin with the standard size tube, they tend to whistle quite a lot, which is called clarinetting. If it's your first time watching the videos. We've got this deeper plug of, this just looks like normal wax. A bit of a mixture.
It's dry, isn't it?
Very, very dry. Squeezing it through. We're lucky we've got a little bit of a suction grip here, because I know these dry pieces can sometimes be a bit of a pain to try and remove, but we have space either side of this wax plug, so we can actually give it a little bit of a wiggle. There you go. Quite a decent size there.
Well, you can see that perforation now, can't you?
Yeah, you can see that little hole just to your right-hand side there. And all that thick, white, sort of cloudy patches you can see on the rest of the eardrum is what we would call tympanosclerosis. I can put my teeth in and say that right. That is just really sort of thick scarring, essentially, is what it is. Here we are, just tidying up these last little bits. Now, I was just going to say, patients that know of a perforation would be unable to use any treatment inside the ears. So I know we kind of bang on quite a lot about saying, use oil in your ears before you come in. If you know there's any history of issues like perforations or recent infections in the ears, don't put anything in the ear. Just come in as normal.
Because the perforation's there, if you run the risk of that, whatever you're putting in going through the perforation, it can trigger off an infection in some patients, which is why they're not suitable for things like irrigation. And you have to keep their ears nice and dry as well, because that middle ear space is warm, it's moist, a perfect breeding ground for infection if you get water in there then, or anything passing through that perforation. So this patient's mine. Lovely gent came through, actually watches the channel as well, and he was came through because he's seen this on YouTube, and we can see this really thick, very sticky type of earwax, this one, which is why I've adopted to put a little bit of olive oil in there. It does make a massive difference as well. Guys, if you haven't already, make sure you check out the ear oil competition as well that we posted a couple of days ago, so make sure you enter that as well. You could win an Amazon gift voucher and the full range of ear oil products as well. I know. Nice.
Very exciting.
Nice prize. But you can see it by putting the oil in, it just takes some of the stickiness out of this wax as well.
Yeah.
We're just going to start to try and lift around the edges. It's always a little bit difficult with these types because it is fully formed, perfectly formed to the shape of the ear canal. So it doesn't want to come away easily. It's got this sort of very thin epithelial layer from the surface layer of the canal wall skin's come away and kind of wrapped around it as well. So it's like this sort of wax parcel with this skin wrapping. It's just never easy ones to do. And when they are hanging on and really sticky like this, the wax hangs on to that epithelial layer that's wrapping around it. That epithelial layer is hanging onto the canal wall, so there's just no gap, and it just doesn't want to come away very easily.
So that's where the oil helps to get underneath that, so it slides.
You got it.
A lot easier.
So I say sometimes we put it in, not so much for sort of softening the surface of the wax, but more as almost like sort of lubricating the ear canal. So when you do get it moving, then it really does start to come away easily. So we opted now, we've done as much as we can with the suction there. It's not really breaking down. So we're opted to go in with the Jobson horn here. The Jobson horn, if it's the first video you've ever watched of ours, is this little tool here. It's a manual tool. It's got this little ring shape. You can get two types. You can get a round or an oval. We prefer to use oval Jobson horns. We just find a little bit more useful than the rounds. But we're just taking away and scooping this wax out. Now I'm not able to get behind the plug, and you can see how soft that center is now. It's like really gooey. So it's pushed it all to the sides. There we go. Lifting now. I tend to do this a lot. I use the Jobson horn and go back to the suction then to remove the thinner layers, like you said, they've just been pushed onto the sides of the canal walls. So he's lifting this up now.
Yeah, sometimes you'll find is it'll just squash it all back against the ear canal. If you haven't used any oil, it will just stick itself back to the ear canal. Just makes your job like twice as hard.
Yeah, because you're working on very thin layers of wax and trying to peel those off the canal. Whereas if you've coated it beforehand, it just falls to the canal, but you can lift it off really easily with a bit of suction. So trying to fold the sides in here a minute. It's just starting to come together a little bit.
Gosh, Jen must have been struggling.
He was really struggling, bless him. This gentleman actually did some clay pigeon shooting as well, so he was he puts ear defenders in quite regularly, which is why we get these kind of issues here. It's just sort of compacted the wax a little bit, but yeah, I've been really struggling with this. You can see I'm trying to pull all sides into the center, and that's the nice thing when you use the Jobson horn. It takes this kind of scoop, like a big digger, right through the middle of it, and then you can pull the sides into that gap to get them away from the canal walls then.
Ooh, you can see it's starting to move. The whole thing is like wiggling slightly.
It's getting that little bit of movement there. So a bit more olive oil going in now. It's not unusual for us to use a couple of, use the olive oil a couple of times as we're going down the canal, just because what you find is when somebody's prepared their ears, which this gentleman had done, but it only softens what it comes into contact with. And if you've got this really full ear canal, then you're going to go through different sort of consistencies of wax on the way down on you. So by putting the olive oil in, every couple of minutes, is going to help that to come away.
Yeah.
There you go. We've pulled it forwards, but it's got a little bit stuck.
Oh, don't push it in.
I know. It was so close. I thought, oh, it might do. But it did actually come forwards. There you go. Look at that coming away. So that's the end of the plug there. So we've just got a little bit more just inside the ear canal to remove. Nice and easy now because it's all been pulled right to the entrance of the canal, so we can get just above it.
A lot more space now as well. So we've got plenty of room.
And less chance, like you said, of pushing it back.
Yeah.
Look at the size.
No wonder that was holding in there.
Yes, that's a good plug.
It's like a shoehorn.
It was huge. It was a very
Not a
old size
shoehorn.
plug.
What do you call them? They put them in shoes to stretch them sometimes. Shoe stretcher.
Shoe stretcher.
I don't know.
I don't know. There's probably a really good. No, somebody will know in the comments because they usually do.
Fun fact, I actually used to work in a shoe shop. So.
Oh, you did? Yeah, that's right. Yeah, you worked for
a long time ago.
Yeah. Bless him. What was your job in the shoe shop?
I was a shoe fitter.
You were a shoe fitter?
Yeah, for
that's
kids.
Cool. That's right.
Measuring feet.
It's mad, isn't it? You'll find like a lot of audiologists will have done something really different before they became. Like I was a tyre fitter before I became an audiologist. You fitted shoes. And wasn't Neil a pastry chef?
Oh, I don't know.
I apologise if that's wrong. I could have sworn at some point he said he was a pastry chef. I don't know. I'm not too sure. I can't quite remember. Yeah, so we just get this. We've kind of gone off topic again. This happens a lot when we get together videos. So we're just taking this little bit away now. This one, a little bit more soft, mushy, super duper sticky. So when you're kind of moving it, I'm trying to move it from one side of the canal to the other. What it's done is just taken the wax and stuck this side, just stuck it on the other side. So not an easy one to get away, but it is quite crumbly.
Yeah. So I hate these ones. They just take so long.
They do, and what you don't see is every time I'm touching the wax, it's actually taking a little bit off.
There you go.
That's the wiggle we wanted to see. There we go.
Hey, you've done this before, haven't you?
That's once or twice.
Perfect technique.
I hate to think how many times, how many wax removals we've done over the years.
We do about 1,000 a year, don't we?
We do a lot. Yeah, I think we've got about 11,000 people on our database. I think, as far as I can remember, there's a lot of people. I remember that. There we go. Out. This is starting to come. It's going to get wedged, I think, or is it going to go? Oh, it might go. Sometimes they get wedged as they get to the outer portion of the ear canal, but this is coming away nicely. Out that comes. Lovely looking plug, that one.
Smooth as well.
It was. Look how
clean.
Let's say another tail green. Say another. Look at that. Look at that. You've got it. Hang on. This is 3.5 centimeters, 1.5 inches. I'm going to go with that one. There is you've got an epic eardrum peel coming up in one of the videos soon as well. I edited that the other day, and fair play, that was that. I was looking at that thinking, where the heck are you going to go with this now? And it was just awesome. So that's coming up real soon, guys, so make sure you stay tuned for that one. I completely forgot to tell you to like, heart, share, follow, and subscribe. If you enjoy the videos, that would be absolutely fantastic. If you have ear problems yourself, whether that be earwax problems, hearing problems, you're interested in hearing aids, anything at all ear related, make sure you check out the link tree in the description. You can reserve yourself an appointment with myself or the lovely Mr. Taylor Green. And as always, guys, take care of yourselves.
Take care of your ears.
And take care of one another, and we shall see you again real soon. Bye, everyone.
Bye.